So we started with a little prayer and just get ourselves here this morning. Lord, thanks for bringing us together to learn and continually grow in our understanding of the world and the people around us. Thanks for taking the time to be with us here today and help us live lives that are full of love for others. I appreciate y'all being here. This is, I think it's a really cool thing that Damon has put together, and I'm really gracious. I'm really grateful that they've allowed us to take this time, but hopefully it's a win-win for everybody. I'll tell you a little bit about what's going to happen today and then the next week and the next week, because this is a 3-part deal. And so we'll kind of go over that, but I really appreciate you taking the time to learn about this. This is a community-wide effort and it's something that we're all learning about and growing through. We did our little blessing, and do you want to add anything here to?
Don't need to add anything. Thank you for doing a little blessing, and Brady, thank you for being here and for the program. I'm excited about these 3 weeks. I think it's gonna be really meaningful and ties really well into the sermon this week. So pay attention and then go to church at 10:30 and see how the two are connected. So.
I like the link.
Maybe they'll provide that for
So the plan, we're gonna take a little bit of time to just reflect ourselves, because so much of what, when we talk about poverty, and this is gonna be a conversation about poverty as well as what we're doing to work on it in our community, is a personal reflection and how the stories that we have and the narratives we have. So we'll take a little bit of time with that. We're gonna share how this is really an incredible time to alleviate poverty. Not necessarily across the whole world, certainly here in the United States, certainly in Nebraska. It's a fantastic time to do this, a great time to focus on things. Why it's not happening, what's the struggle, what's the challenge, why are we not getting it quite so easily as we could potentially? And why we developed Bridging Forward, that's the name of the program that you're gonna learn more and more about. We'll learn about what it is and how it works and share some of the results so far. We've been doing this now for 2.5 years, so we've got some great results to show as well. And then the way this connects for the next 3 weeks, so today is a little bit like, hey, get some understanding, get some broad overview of here's what's going on. And then next week, we have several members of the congregation that are volunteers for Bridging Forward. And so Steph and Andy and Constance and Tammy and Alka and Dan are all allies that have been experiencing this and working with Bridging Forward participants for the last several months. So they'll share their experiences. And then the following week on the 26th, we'll actually have a panel of Bridging Forward participants, so they'll be able to share some of their experiences, but also just have an opportunity to just do their own back and forth. So the whole idea here is to kind of braid this thing with you. And I think that's really important. It's really easy to keep something like this kind of at a distance and learn about it, which is no problem, right? Like, it's okay to just be here to learn. But it's also, I think, an opportunity for us, especially as Presbyterians, to be thinking about where is my role in this? And where do I intersect? And I'm not talking about donors. Okay, that could be a response you have, but it's more about just as a human being, where do I exist in this story? So I'm gonna read a thing that I just came across that is kind of in this vein. It's there's a book called Braiding Sweetgrass that is a great read. Several of you nodding your heads, so that's good to know. But the intro is a nice way to start us out here. So a sheaf of sweetgrass, bound at the end and divided into thirds, is ready to braid. In braiding sweetgrass so that it is smooth, glossy, and worthy of the gift, a certain amount of tension is needed. As any little girl with tight braids will tell you, you have to pull a bit. Of course, you can do it yourself by tying one into a chair or by holding it in your teeth and braiding backward away from yourself. But the sweetest way is to have someone else hold that end, so you pull gently against each other, all the while leaning in head to head, chatting and laughing, watching each other's hands, one holding steady while the other shifts the slim bundles over one another, each in its turn. Linked by sweetgrass, there is reciprocity between you. Linked by sweetgrass, the holder is as vital as the braider. The braid becomes finer and thinner as you near the end until you're braiding individual blades of grass, and then you tie it off. When you hold the end of the bundle, will you hold the end of the bundle while I braid? And then I'll hold for you and we'll braid together. The whole idea I want you to think about is that we're just gonna take different pieces of this. We're gonna learn about the technology, the kind of information behind it, and have some thoughts about what is poverty. And then we'll braid together the experiences of the volunteers who are outside of maybe poverty and intersecting themselves in poverty. And then we'll hear about the folks who are really dealing with the overwhelm of poverty and put all that together and see what we come up with at the end. Sound good? Okay. There's always gonna be some personal reflection for you, so get ready for this. So there's a couple things to think about here. The poverty of the poor is not a call to generous relief action, but a demand that we change the structures of society that make the poor poor. Bridging Forward is not just a program for helping individuals. It's the whole idea that, hey, we can't really solve poverty unless we also look at the big picture, the systemic stuff. So while there's lots of things happening that are helping individuals, ideally, there's lots of things we're doing in the background that are helping things like housing and transportation, healthcare, things like that. So we'll learn a little bit about that as well. And then we must constantly challenge dehumanizing public representations of poverty and the poor. I think one of the main things that we found and that we see with the volunteers and the allies, working with Brady Forward is a lot of it is about, hey, let's challenge our notions that we have about people and why people are poor. And there's a great back and forth that is meant to be, that we call it our poverty IQ. So we often have real strong stereotypes about, people that are poor and have been dealing with different kinds of life. And so there's an opportunity here for us to change that narrative, and we need to have a different narrative. If we're gonna change the system things, we need to be telling a different story. So this is a chance for you, right, to just kind of play with your own stereotypes. So I'm gonna ask you respectfully, just close your eyes for a minute. And I want you to just imagine a place in the community that you would encounter somebody who you would imagine to be poor. And I want you to make a really rich picture of that place, where you're at, what's the setting, what's the time of day. And then I want you to really imagine that person and fill it with your own view. When you think of a poor person, somebody that's impoverished, somebody that's in poverty, what are they looking like, dressed like, all the different things. Put as many things around there as possible about that person. Don't be embarrassed, right? We all have different stereotypes. Some are gonna be really great, some are gonna be really challenging. And I'm just gonna ask you some qualities about your person that you're envisioning. And if it's true for you, you can raise your hand or nod your head. I'm not gonna be calling anybody out. I'm not gonna be keeping score. This is just an opportunity for you to kind of question your own way that you're thinking and also be thinking about it. So I want you to kind of think internally and pay attention to yourself as I'm asking these questions. What it causes for you. Everybody's got their person in mind and their setting in mind. Is your person male? Raise your hand or nod your head. Is your person female? Is your person white? Is your person Hispanic? Is your person African American? Or another race? Is your person in love? Is your person overweight? Does your person have a broken home or come from a broken home? Does your person have a job? Is your person intimidated by you? Is your person artistic? Does your person read to their kids? Is your person mentally unstable? Is your person overweight? Is your person an addict or have a history of addiction? Is your person married? Does your person come from parents who were also poor? Does your person pay taxes? Is your person on government assistance? Does your person have a deep religious faith? Is your person someone's best friend? Does your person dream of being a nurse or a doctor or a fireman when they were little? Is there a person taking advantage of the system? You ready? You can open your eyes. Thank you very much for doing that. There's some thoughts you had as you were responding to those questions or thinking through that yourself. Anything that came to mind for you? No wrong answers. I don't know the guy. Don't know.
I've never thought about those human connections about, you know, are they married, is their best friend, are they artistic, you know? Other questions that I would ask in other relationships, or I would know. That was embarrassing for me.
Yeah, the internal life, their internal life is the one that, you know, you just see what's on the outside. I think that's kind of what you're saying, Susan.
It's so easy to fall into just like the stereotype trap of like, oh, I just assume that they're on government assistance and, you know, you don't humanize them. You kind of provide them in what you would consider a box.
Mine was based on a real experience, so I visualized that person, but I've had several, because I live near the park, the Alexander Park, and there's always someone you can have a conversation with, it's going to go hard times.
Had I made different choices? Had I been born into a family, it could have been me.
Our interactions are brief, but they're all positive. We do something for each other each time we talk. It's very clear.
A little bit about the relationship of poverty and homeless, which we have, of course, in Hastings,
Yeah, we
as
made,
you referred to. I see that when I know where to look when I ride and jog.
yeah. Yeah, I think, so we definitely can talk about that. I appreciate all these answers, but it is one thing that I think we want to be doing through these next 3 weeks as we're braiding the sweetgrass is thinking about there's human beings involved in the story. And we often have a story that doesn't give the complete sense of that human being or those human beings. And so as we're growing in our understanding, we want to grow in our ability to take in other stories and add other elements. And you'll see the people on the 3rd week, on the 26th, incredible human beings. They're 100%. And it's not seen though, it's not necessarily visible right away. And so it takes a little bit to get there. And that's what I think we're hopefully be all about. Thanks for that. Thanks for participating. Why are people in poverty? No wrong answers again. What do you think about why people are in poverty? Gordon,
Some of it's medical or some other thing that got them there.
something else. There's some outside force. There's some kind of medical issue, mental health, physical health. Okay. Why are people in poverty?
Drug addiction.
Drug addiction. Okay.
The cost of housing.
It's really expensive and to have things, especially core things like a house, really impossible. Why else are people in poverty?
Yeah, no choices.
Poor choices. Yeah, but there's a great belief, right, that people, the choices that they made are to get them there, right? What else? We're dealing right on that thin edge between stereotypes and reality, right? And it's okay. It's okay, because this is the narrative about poverty. It's easy to be on poverty. I get paid to be on poverty. You hear that story, right? I'm on welfare, I get government assistance.
But generational, I think, you know, born into it, but generational poverty is hard cycle to break.
Generational poverty. People don't work hard enough, right? That's a story about poverty. Okay. So lots of them, again, we'll hear these as we go, but just, I want to be thinking about that, and maybe as you're in between these 3 weeks, whether you come each time or not, be thinking about that and be listening for the stories that we tell about poverty. And some of them are accurate, right? Some of them, there's a real basis in that. It's very difficult to own a home in our community, right? And that's a core value, it's a core way to get people out of being poor, is to have equity and have a home. But that's a challenge. But it's a perfect time to get people out of poverty. Isn't this weird? To be thinking this way, but I want you to think this way. This is a weird thing, but it's an incredible time. We have an incredible opportunity, especially in this community. We have one of the lowest unemployment rates in the country. Okay, 2.4%, it used to be 1.8%. In the state of Nebraska, we're almost the lowest. Okay, in October, there's 2,100 open jobs. Okay, now you gotta hold that up with, there's low unemployment, and there's all these open jobs. So the whole idea about bridging forward is that we're operating for the assumption that people are underemployed. And that if we can get people into a higher wage job, this is the best opportunity to do it. Okay, that doesn't sound hard, right? Let's just get people into higher wage jobs. Okay, they're working at Casey's, not terrible, $12.50 an hour. You can go today to get hired in Casey's this afternoon if you want to. Did you know that? You could go get your coffee this morning, and this afternoon, or maybe Monday, because it's a weekend, you could have a job at Casey's. Okay, so there's people that have that job. And there's all these other jobs without any hard work. A little bit of hard work. At the Hartwell's Renewables, their starting wage is $26 an hour.
Yeah.
And they've got all kinds of jobs that they're working to get people into that's gonna build up to even higher. They don't necessarily need to have somebody that's skilled at fixing pipe heads or machining things. They need people that are gonna show up to work. Okay, that doesn't sound too hard. This is a great time then to let's get that people, those folks that are in one place, into this higher wage job. 34%, this is a way to think about this, and I want you to start thinking about the challenge of poverty and the struggle of Adams County households or Alice households. If you've heard that term before or not, I'll explain it a little bit. Asset limited, they don't have a lot of assets, so when you think about assets, that'd be things like, hey, could I live for 3 months? If I don't have a job, I don't have assets if I can't do that. If I could, I've got assets. I can sell some things. I've got money in the bank. Okay, so they're asset limited, income constrained. So there's not a ceiling, but there's a barrier up here on their income, but they're employed. So if you're 100% of the federal poverty line, you're automatically qualifying as an Alice household. That's 12% in our county. Okay, and I'll talk about the federal poverty line in a minute. But then there's folks who are between that 100% and 200%. 200% of the federal poverty line is just about making a minimum wage, is making a well-being wage. Okay, that I have enough to live, I have enough to start putting into savings, I have enough to start taking care of my health care. I'm off of government assistance. So the numbers here, you can see them here, and you don't have to memorize this, but 200% of the federal poverty line for one person, that means they're making $30,000. So I have a living wage if I'm making that much money for one person. A family of 4, okay, so maybe 2 income earners in the household, they're making together $62,400. Would put them at a living wage. You can find ways that you can say that that living wage, even that's not in the ballpark. There's a great calculator if you want to play around with it on MIT's website that has a living wage calculator. It's geographic specific, so you can put in your zip code and you can see the cost of goods. Theirs would say 73,000. The living wage. So you can see that we're aiming in this program and bringing forward, we'll talk about it a little bit to get people to this number. It's working, it's a challenge, but why is it a challenge? Let's talk about that really quick. You stop me at any time if you'd like to ask some questions here along the way, but what's the problem? Okay, we've got this person, okay, let's call him $12 Tim. We don't spend a whole lot of time with $12 Tim, but he's got signs all around him. They're saying, we're hiring, we're hiring, we're hiring. And it's even better than that. Not only are there's signs saying we're hiring, but there's all kinds of other opportunities. I promise you that if you start listening for it, over the next week, you'll hear 3 or 4 of these opportunities that are out there in the community. You can come work with somebody that's a virtual recruiter. I don't even have to talk to you in person. You don't even have to come meet me. The Hartwell Renewables, you don't even have to come meet the person to get the first initial conversation going. You can do it over the phone. Job search help, interview practice, resume help. There's all kinds of opportunities we have for this. There's free trainings. You can get a one-on-one job coach if you're using SNAP benefits. If you get food stamps, you have the opportunity to get a one-on-one job coach. Here, clothing paid for, signing bonuses, 2-day, tuition reimbursement. If you're on Medicaid with Molina, you get a personal well-being coach that includes job advancement, job training, resume building, Molina Healthcare. Flexible scheduling, hiring fairs left and right, apprenticeship programs. You can get coaching on your benefit cliff and like what happens if you're gonna lose benefits, gap assistance from CCC. Okay, if you can't afford education, Intern Nebraska is starting up. All these kinds of opportunities, right? So what's keeping Tim working at this $12 an hour thing. Let's take a look. And this is what we see. We can't get there. Tim is having a really hard time getting there from here. And it's a weird thing. It's a weird dynamic, and you'll sit here and you'll question, like, it can't be that hard. Okay, here's all these things that are out here, all these opportunities, and Tim's still doing the gas station job. Well, Tim's spinning a ton of plates. And maybe it's not Tim, maybe it's Tammy, maybe it's whoever, right? But all these plates, there's lots of different things going on in life, and you can imagine some of these, right? And they're keeping things, there's a little bit of an overwhelm there. There's people that are not just spinning 5 plates, they're spinning 20 plates. In fact, that's most often the case. Okay, and those plates become that barrier. It's really difficult that, and this is what we see, this is personal, experience, and you've seen this probably as well. That there's all these things, and you can read this list of excuses. It'd be easy to do that, right? It'd be easy to read that list of excuses, that wall of excuses. But it's something that I want you to consider, and sorry, indeed, you're familiar with this, but you can't see it. But all those things are creating a barrier. And you'll hear that from folks that you'll meet in the next couple of weeks, that there's all kinds of opportunities for them that are within reach, but there's just some things keeping them from here getting to there. And so bridging forward, the whole idea of it is designed to do a little bit of hand holding to help get Tim from this place to start putting a little bit of reduction in the overwhelm and some help mitigating these barriers to get over here. It's not hard, but it takes a little bit of time, so that's what bridging forward is all about. So that's what we're designing here. So the idea of bridging forward is basically that, hey, we have all the stuff we need in the community. So we've got the healthcare resources, we've got the transportation. Some of them are not fully at 100% yet, right? We don't have fantastic housing situations, but we have programs that people can get into that are getting there, okay? Nothing here is 100% perfect, but we're doing much better at knitting all this stuff together. If somebody came into the United Way office or Catholic Social Services or Faith Lutheran Church and they said, I need some help, we're gonna figure out a way to get that person some help. What we have not done well in the past is making sure that after they've gotten that emergency help, they get onto the next step. Okay, so maybe if you go back here to where Tim's at, Revive is fantastic, right? They're building their services. So if Tim's dealing with addiction, that's the thing. We can't focus on getting Tim out of poverty right then. We've got to work on making sure that Tim's got some help with some addiction. But afterwards, Revive now has lots of places in the community that they can say, okay, Tim's got 6 months sobriety. We've gotten some other things figured out during that time. Let's start making sure that we can knit this stuff together. And so we're getting better and better at that, and that's what bridging forward is about. So that's what we'll learn about here. It says applying the collective impact model to the bold goal of reducing poverty by 30% by 2030. So this is that goal that you hear. This is the vision of the Community Impact Network and the United Way. So just really quick, so you get the backstory here. The Community Impact Network is a local collaborative, 70 different organizations. First Pres is a part of it. The schools are a part of it. The hospitals are part of it. Okay, nonprofits in the community are part of it. Agencies, government programs, DHHS would say they're a part of it. So it's all working together. It's not an organization, right? There's no 501c3 called the Community Impact Network. It's a collaborative of lots of different organizations. We'll talk about it just a little bit here, but the collaborative, the Community Impact Network, embraced this goal of reducing poverty 30% by 2030 in 2021. Okay, after the COVID pandemic kind of got settled out, all this collaborative and lots of community members, several people in this room came together and said, what's needed and wanted in this community? And the number one thing that came to the top was supporting the most vulnerable. The idea being that if we can figure out a way to support the most vulnerable, everything else is gonna benefit. We're gonna get better at communicating with each other. We're gonna get better at building systems to help people. We're gonna get better at collaborating and working to solve complex problems. So that's the whole goal that had the collaborative embrace that goal. What was great about it was that the United Way at the same time was saying, we need to think bigger. And the reason why I'm combining these two is that the United Way is the fiscal agent for the Community Impact Network. So my role as the coordinator for the collaborative, the Community Impact Network, is funded through Nebraska Children and Family Foundation. I'll tell about that in just a real quick minute. But all that money flows through United Way. The great thing about it is that the United Way 5 or 6 years ago started saying, hey, we need to be more transformational. We've been putting Band-Aids on things and kind of rolling the dice and hoping that it would work. we need to take a deeper investment into sustainable long-term change. So United Way also embraced a bold goal of 20% by, 30% by 2030. And that was great because the United Way has this social cachet, right? It's a believable agency. People have a lot of respect for the United Way. They're doing good work. Embrace this more transformative mission in 2021, looking at that deeper long-term impact. And so the whole thing resulted in bridging forward. They're combined us. So just give you that backstory so you can think about it that way. Any quick questions about that? All right, so I'm just gonna blaze through this, but I want you to know that the Community Impact Network is one of 23 other collaboratives in the state. So Nebraska's got this really interesting and cool model of using these community collaboratives. We're unique in the whole country. No other state has this model. The collaborative exists to solve problems that no single entity can solve alone. Have a cool idea. We know that more brains are better when you get them around the table, okay? So that's the whole idea. Who knows what's gonna happen when you put a bunch of folks together and have some good conversation around embracing challenges. Together, we're working to build this most robust community-based prevention system in the nation with all these other collaboratives. So it's not just us doing it, but just know that it's happening in the background. There's some really cool stuff happening. Love to talk about it with you more. There's some paperwork on the back there if you're curious about it. But there's all kinds of different things. I can't remember all the different buttons I pushed here. So, so there's all kinds of different things happening. Again, you don't have to know this except to just know that it's kind of cool. There's a lot of heads turning to Nebraska because we are the only state putting this together so strategically and so deeply. There's some big funders, national partners, state partners, community partners, policymakers, parent and youth leaders, all building some efficient systems, policy advocacy, strategic focus. There's a whole statewide plan for this community well-being prevention system. It's gonna take a long time. This is a 20-year kind of vision, but just know that it's happening in the background and it's pretty cool. I'll pause again, any quick questions? Let's watch this. So this is now, we're gonna just talk about bridging forward and then I'll show you the results. But this is, on our website. You can see bridgingforward.org. There's a couple others. I'm just gonna show this one. And then, if you've got time, you can go look at the rest of it.
Life leading up to this point has been, surrounded with drugs and alcohol. I got out of incarceration after spending a decade, being locked up. Shortly after getting released from prison, I suffered the loss of a child. I relapsed and kind of had a hard time. I bounced from job to job, just because I don't have a special skill set per se. I had called down here for something unrelated, and that was about the time that he had put this program kind of slowly together, asking me if I would be a part of it, from my past experiences in life. And what he showed me that he was trying to do, I agreed to it because I felt like it was something that would be not only positive for myself, but positive for our community. I've been on the program for 6 months. I have been doing peer support training, and then I've done some other training where I've realized that my head isn't exactly in the right place and that I need to do more. That my surrounding has a big part of my mental health and what I can and can't be a part of today. Just trying to learn how to better myself and to recognize inner stressors and triggers as far as what life brings and the people that bring it. Just trying to figure out how to deal with myself in a better way. I personally hope that my girls will see everything that their father has done, being a single dad and doing everything that I've done the last 10 years to not only survive, but to not give up no matter what the circumstances. Even if it is painful and it's a lonely road sometimes, that we just need to persevere and make it. I have learned that there are people that are willing to help. There are organizations who do care about people that have struggled. I feel like Brady is on something. If we could all join forces, I feel like just a little bit of momentum people would start to see, and then it would get a bigger following. All people need to step up, no matter how or where you come from, which walk of life you've been. We all have to join and make a difference together, or otherwise it's never going to work.
go through this life and nobody, you can't really measure people's lives and experiences and say, oh, people have different traumas, and say I've had it worse or I've had it better. For me, I just had a different type of life, I've survived some things, I've survived 3 civil wars. Nothing is really too hard for me, but addiction was. I was just at a very lost time in my life. I didn't have custody of my kids. I was just all over the place. So to find this program and someone says, we got you stable, you're stable, you have your house, I have my kids back and, but, for someone to be like, okay, that's not it, that's good, but that's not enough. Let's get you to prosperity. Let's get you to more than civilization. That helped me a lot. Chandra, I don't, with daycare stuff and I'm having overnights with my kid, which is great. But then I have to coordinate daycare. Another thing that they do is try to work with jobs in the community and connect with those jobs so that those jobs can connect with us. The program gives me like sense of direction. It gives me a step-by-step reality of what I need to do, to get to where I need to be. And they don't do the work for you. You have to do the work. You are the engine, behind your own dreams. But they are there for you. They are the helping hand. And for someone to look at you and believe in you and say, you know what, I believe in you. Then you're more than that. You're more than just getting to a stable place and that you can go back to education. Sometimes it just takes someone to believe in you. I mean, just a year ago, I didn't have my kids and right now I'm overwhelmed because I have my kids and I have all these things and and I'm running late to places because I have places to go. You know what I mean? It's amazing. I'm so happy and I'm happy. I'm happy.
Josh and Char came from a background of addiction. That's not necessarily the case with everybody, but it is one piece of it, certainly. As we said in the, kind of our stories of it, it's one of the challenges for sure.
Do you want to tell them like where they are now? Because that was a while back.
Yeah, that was a while back and I always feel a little bit self-conscious that Josh talking about me. It really is a collaborative effort that has designed this thing, but Josh right now is employed by us and does work in outreach, does a lot of work in the community, connect people to bringing forward. Chara as well, works as an advocate for the Noir community. She translates for us at times, and she does the same thing. She was an internal coach for a couple people, so it's been great to see. And that's not a single story. We have 3 other people that are doing work that have been past participants who are now getting involved in the program. It's important. So what is a circle leader? So this is a term you're gonna hear in Bridging Forward. A circle leader is a participant that said, hey, I'm interested. I'm committed to moving out of poverty. I want to reach that 200% of the federal poverty guideline at least. They've completed a training. So we do I'll share about this as we go. It's a year-long program. For the first 3 months, they're working just together in a group, kind of like a class setting, a cohort of people that we do a lot of financial literacy. There's a lot of self goal planning. There's some self-advocacy. There's a lot of learning about what it's like to live in cross-class lines. And it's somebody who said, hey, I know this is gonna take some work from me, and so I'm tired of the overwhelm. I need to do something else. I need some support. That's a key piece of it. It's not somebody who's like, hey, I can do this on my own. That is often what $12 Tim is thinking, right? I can do this, there's no problem. And it's a reasonable response, but that overwhelm, it's very limiting. And I think that we'll see that more and more. Maybe you'll hear that on the 26th, that when there's so much stuff going on in life, it's very difficult to see all those options. They're very easy for us to see, or for folks who are not dealing with poverty, very easy for us to see these other options, really challenging for others. They want to just stick it out through the highs and lows for 1 year, because it's a meeting weekly. It's a lot of work to be a participant in Bridging Forward. The model is that there's a participant, so the circle leader. And after that training, they get matched up with two allies, volunteer allies. You'll hear about, their experience next week. And then in the background, there's a support team. So you can't quite see everything, but the support team, the resource team, those allies don't have to know about, hey, how do I get somebody a voucher? What is this stuff about, disability or Medicaid? What are these things? And so, the resource team, that's their job to help connect those dots and help provide some guidance on the stuff that the allies don't know. But the idea is that the circle leader is building a circle of support out of poverty. They're the one that's the leader of their circle. And they have their goals that they're working towards, that the allies are responding to and helping them move towards and move to meet them. It's 1 year, meeting weekly, working on personal financial goals with the meetings with full support of the allies and a resource team while simultaneously addressing system challenges. And that part is key. That, as you heard from Josh, so like, yes, he's in and he got some help in the program, but he's also now addressing all this stuff on the outside, some of these system issues. The weekly meeting, this is just to let you have a sense of what they're doing, and you're always welcome. It's Mondays, 5:30 to 7:30 at Peace Lutheran. We need to start doing it in other churches, so it's good to know, like, hey, here's what this is. So this is a good kind of advocacy piece I want to put out there. So currently meeting on Mondays, it's 2 hours, provide childcare, provide a meal. We have the gracious help of A and B and Constance, they do the cooking, which is fantastic. The first cohort we started out with, we were providing the meals and that's no problem, but they really have stepped up to the plate and said, hey, we'll take care of the cooking, which has been fantastic. And the childcare is not just childcare, it's actually programming. We'll learn a little bit here in just a minute about, is a 2-generation model. So we're working with the adults, but we also want to make sure that the young people are getting kind of the care and feeding needed so that they're dealing with, because as somebody mentioned, they've got their own trauma and their experiences are gonna then potentially lead to their own generational poverty unless we do something now. During that time, there's some community time and we keep building that community, but then there's also opportunities for the allies and the circle leaders to meet together. And so that's where, we may have 20 or 30 minutes where we're checking in and sharing some updates, but then it's time for the allies to meet with their circle leader and work on their goals. So sorry, you can kind of see how it works. At the first 3 months, there's this training portion, then the next 9 months, getting matched with the allies. For this new program that we'll start, we're actually starting next Monday. They'll meet weekly, every other week with the allies. And so it'll be a little bit different, but it still is the same idea of regular focus, regular work on things that people are paying attention to. I mentioned it's a 2-generation model, so this is really key. Every single, the first cohort we had, there were 36 kids as part of 11 adult participants. So just think about the profound impact that has. If we can have any kind of impact on those 11 adults, that ripple on those 36 kids can really be profound. It's the same thing happened. The second cohort didn't have quite as many kids, but still some kids that were there. We've done the model, we've done the measuring on this, and we'll learn about this on the last week, on the 26th. But you can see an incredible return on investment. When it makes a difference on the life of the parent, okay, then you think about, okay, there's a real cost to childhood poverty. We know that kid, if that kid stays in poverty, we can see the ripple impacts in the system and the way the government assistance is gonna need to also be there for that child in the future, unless we can get them out of poverty now. The return on investment gets to these outrageous numbers. Pause me at any time here. I'm gonna start going into the results and then we can get some time for questions. So it's working. The model is really working. We're struggling with a couple things. I'm not gonna shy away from telling you about that. We're struggling with keeping people in the program. We started that first cohort, started with 11 and finished with 5. I don't know that we had the magic wand there, and we will talk about it. Maybe we'll hear about it from the participants as well. In fact, if we can remember, we'll ask that question. But that happened as well with the second cohort. We started with 12, we're now at 6. So 50% drop off. Now nationwide, they see a similar thing. So we're using a model that's based on Circles USA. Circles USA is in 20 different states. It's a model that we use that gives us this kind of guideline. And several programs are experiencing the same thing. We're working to figure that out. This third cohort, we'll see if we can have something different. But for the folks that are staying in, this is the results. So their individual circle leader monthly gross income, a 254% increase. So you'll see the different points of data here. The intake, that's the number, the average income per individual. And then after that, 3 months, okay, a quick increase already. After 6 months being in the program, so this is where the second cohort is right now. And then after 12 months, 250, these are real numbers. So those 5 people, I can go through each one of them. I can say, oh yeah, there's this story that happened with her, and here's this job improvement that happened here. Household wise, same thing. These really enormous, significant changes in poverty level. Because not only is could be the parent that's there, but also the partner or other impacts on the household income. It's not just the money though. There's all these other pieces that we want to start measuring. So you can see that the blue line represents full-time employment, so increased over time. Unemployment is the orange line that decreased, part-time employment decreased. The education level, there's, out of the 11 people that we have, you can see that, it's still not a big sample size, but there's people getting additional training. This one's a pretty profound one. We asked a question in the beginning about who can you count on, the number of people you can count on if you're in stress or in trouble. And you can just see the sharp increase over time. This is priceless, right? I mean, as we're thinking about the human beingness of the story we tell about poverty and that human that's there in front of you, whether you're imagining somebody at Russ's or wherever you're envisioning that person during the time when your eyes were closed. Imagine how many people that person had in their support network, right? And the limiting influence of that. And over time, if we can find ways to walk alongside people, that support network enlarges. And it's not just, okay, now I know who I can call if I'm in trouble. That's 14 different perspectives. It's 14 different life experiences that are maybe not my life experiences, right? That's a key piece. Like I'm enlarging this circle of people that I know. And when you enlarge a circle of people that you know across class lines, you're learning different things. We had one gal that she'll probably be here on the 26th. She did not realize that the amount of money she was spending on rent was about $300 more than she would pay on her mortgage. I have no idea. Nobody had ever had that conversation with her, that she was eligible for several different first-time homeowner programs, that she could be saving that kind of money. Now, for folks that are in a middle income or a higher income bracket, that's a no-brainer. I go, hey, why don't you think about owning a home? It never crossed her mind that that was an opportunity for her, that she could have a money savings there. So that support network helped enlarge that perspective base for her. And it wasn't like a, hey, you dummy. It was more of a, oh, this is a huge gap in just the life experience you've had versus the life experience I've had, that let's now broaden that life experience. So a key piece there is that support network that increases. Here's another one that's kind of priceless. And then this is the last of the results that I'll show you for now, but this is several different metrics of elements where you can grade your, where you're struggling, like transportation, housing, healthcare, mental health. And so you can see that the scale goes from on the initial intake to 12 months, but it goes from surviving to thriving. And so, we're not working with people. You can tell even in the beginning, we weren't working with folks that were in super crisis. That's not what Bridging Forward is really for. It's for, hey, let's handle that crisis. Because we can't work at getting out of poverty unless we're dealing with that part first. But once we can get people stable, all right, now we can start looking at these other things and now start having folks. And people are answering questions about thriving and responding to things like, hey, I'm thriving now, even though their poverty level has not necessarily gotten to that 200%. So it's interesting to see that part as well. So this is the last thing I'll leave you with, and then ask some questions, and we can keep talking here a little bit, but the poor don't want some small life. This is something that we certainly have seen, and it makes sense when you think about it. They don't want to game the system. That's a story people tell. I've never seen it in the 4 years that we've worked here. And hundreds of people haven't seen that. They want to contribute, they want to thrive, but poverty reduces people born for better things. Matthew Desmond, there's a great book called Poverty by America. I also wrote one about the housing crisis. So I'll stop right there. There's more to learn about this, and we'll keep reading this idea, but open to questions, open to reflections, certainly the folks that are in ready for it, there's things I skipped, jump in here, but. Yeah,
I'm still trying to get my head around something you said maybe 20 minutes ago, and that this is the only model in the United States. Can you unpack that model exactly? Because I cannot imagine that there's nowhere else in the United States that's not thinking about the second step. Or is it the fact that we've got Community Impact Network and then United Way, and then we have all these other statewide organizations? Is that the model you're talking about?
this is the model that I'm talking about, that, you know, we're the only state that has this community collaborative idea.
Okay,
So, you know, you can go, there's incredible programs happening in, you know, poverty alleviation programs happening in lots of different places. And there's lots of, if you've ever heard about like the Harlem Children's Zone or the Meta Project in San Francisco, they're called place-based. Hey, we're gonna work with this community. We're gonna work with this 7-block radius, and we're gonna make sure that every family in there goes from that crisis point to that prosperity point. We're gonna wrap around supports. Nebraska is the only place right now that's come up with this. Hey, within every community, these large rural communities, there's no way that a family here is getting supports that are here unless we can all work together and knit those resources together,
right.
okay? This is not, there's Minnesota has a little bit of a collaborative model, but the cool thing about Nebraska is that, hey, every collaborative, even though it's built a little bit differently, every collaborative is aiming towards this thing right here. How do we build the most robust prevention system possible in the nation? Nebraska used to be really proud of being one of the top states that removed children from unsafe homes. Used to be really proud of that. Hey, that's a good number. Let's be proud of, hey, we took kids out of homes that were not safe. Okay, maybe there's abuse going on, or maybe neglect going on. But then they started asking the question, and Nebraska Children and Family Foundation asked this question, Suzanne Shore, the Pete Ricketts' wife. Lots of different people were part of this conversation 7 or 8 years ago. So let's stop being proud of that number. Let's be proud of the number of homes that we made safer so that kids didn't have to be removed. So that's a big thing. That's a big idea, but it took a lot of shifting of the system. The model for, you know, one of the state partners is Department of Health and Human Services. They are the child welfare agency in the state. And their whole idea is, hey, we're not gonna put a kid in an unsafe home. They weren't necessarily thinking or designed or set up to be more preventative. So let's see what we can do now, and of course, that's a broad statement, right? There's people doing great work to help make homes safer. But statewide, this is the only state in the country that's working to say, hey, let's do this all together. And we've got to align all this different thinking, some of these big bureaucracies, right? This is a big ship to shift. The Department of Justice, you know, juvenile justice, it's a big shift for them. You know, can I put a kid in this home if I don't have faith that the parents are in good shape? Okay, that's a great question. Let's not do that. Let's actually find some ways to get those parents a little bit better footing underneath them. So anyway, long answer to your question, but
No, helpful, thank you.
others, thoughts, questions, perspectives, feedback.
Brady, it strikes me that it's got the potential for a lot of resilience. In other words, some of the programs you mentioned before, the kinds of things that might discover a situation and provide resources for it, and then sort of use other means by which other problems need to be solved over here. So the finances move, people move, and the program sort of dissipates. But this kind of thing allows the resilience to happen when something becomes stronger or weaker. So that it seems like it would work with the winds of political change, for example, or financial change.
So you're not necessarily talking on an individual level, but more as a community.
The web, yeah, the web
Yep.
works, yeah.
Yeah, I think that, you know, one of the things that is happening, that system change in the background that we talked about, is that it's the community rallying around this idea is helping us think about how to do this better, how to work together better. And it's turning some heads. I think that's a tough thing to do, you know, change is tough, and people have, it's hard to believe that something like this could work. There's people who, you know, really think like, hey, that poverty is somebody else's problem, and so how do I make that part of this housing conversation or this economic conversation?
I think the poverty IQ has been really helpful, because putting on my nonprofit hat, working with the nonprofits that are serving and intersecting, with both you and with the clients, the circle leaders, but then also for major employers. Our poverty IQ, in essence, when I was at Hastings College or at Mary Lanning, was really low. And yeah, and as you are going deeper into the workforce, these are people that even 10 years ago, they wouldn't have even gotten an interview. Well, now we need to hire these folks. They need jobs, we need workers on there, and some of our policies are not set up for that. So when you look at anything, whether it's, exclusive 12-hour shift work, that works really great for somebody who has another spouse at home. If you're a single parent, childcare, there's no childcare that goes from 6 to 6, let alone from 5:30 to 6:30 when you actually have to pick up your kids. And so I think it's, employers, we are trying to get in the conversation about how we can support, different types of employees that, again, we were able to kind of turn a blind eye to 10 years ago, now we can't. In there, and how do we put even some of those wraparound supports? So even at the hospital, we've talked about having a full-time employee social worker. So, Pat Kern does an amazing job with all of our patients, but now we have employees that are in the ALIS system. They're fully employed, and yet they're still not making enough to make ends meet. So what can we do to help support in there? So it's been really good for us to learn about that.
That's definitely a whole other piece, the equation, if we're operating from the assumption that people are underemployed, then that other part of the equation is how do we get the employers to be working with folks, just like Susan said. So that's one of those big things happening in the background. We have a employee Hastings work group. There's a lot of cool stuff happening there, because that's one of those big shifts that you have to shift. Here's the way we've been doing things, just like you said. Yeah.
Some of the problems or some of the obstacles that you talked about earlier, all the plates spinning. I couldn't help but think when we were talking about that these are precisely the problems we see with our CCC students who are trying their best. I would say many of them are the folks that we're talking about here, living at 200% of the poverty, federal poverty level, if not below. But we don't have any means to help them like, you're helping these folks. So I'm wondering if maybe that might be a next step along the way, because I see it all the time, and then naturally instructors are just like, well, you've got, if you can't handle it, don't take the class, this test was due at this time, and I'm just like, where's compassion there, I realize you can't deal with everybody individually, but we see this time and time again, and many of our students do not complete their education because of these very problems.
4 meetings. We can get 4 meetings with somebody back to back to back. We can get some momentum built up and a path created that's their path that we're supporting, is generally what I find. Getting past the second one is the hardest one. I can get past somebody in the first time and get them to come back the second time. After that, it's for whatever reason, but those ones that it's about 50%. We can get 4 meetings with somebody, those wraparound supports are there, and we can get some momentum built. Every single person that you'll hear about from Bridging Forward, there's some element of that in there. I came here, I needed something, so you're gonna help me, I'm gonna get this thing I need. I'm gonna have the next meeting, I'm gonna hear a little bit more, but now you're gonna learn a little bit more about me and you're gonna hear the crap. And I'm gonna start to see that, okay, this is too big for me. And then, okay, I made it through that one, and now you're giving me some ideas I haven't thought about, and you're working with me, and I'm gonna make this phone call that I wasn't gonna make last time, and now, yeah, I made that phone call. Oh, it is. Yeah, Jessica, hopefully will be somebody here. Jessica is one of the participants that, Mary Lang is a good example of. She was doing home health care. I'll just do this really quick, 30 seconds. Home health care, thought that was the only job for her. She loved it. Very low wage, tough on her back. And so she was worried that it wasn't gonna continue for long. She had one after that third meeting, and it really was, 3 meetings later. She was like, okay, I'm gonna talk to this nurse recruiter person at Mary Lanning. One phone call, one coffee meeting, hired. Boom. That's all she needed to get that momentum going. And 4 or 5 months later, she was, training as a supervisor. She was getting different wages. So, but it was that naughty, not naughty like bad, but difficult.
Yeah.
A difficult period. And so I think your students, same kind of thing, if we can create that environment. And so we're working with we're trying to develop that kind of coaching mindset and coaching model, but it's a
The
great.
frustrating thing is they don't have that resource.
Yeah.
And I'm just wondering if maybe we can expand what you're doing into,
Yeah,
this
that one-on-one.
Center Community College.
I think there would be some people that, I mean, you said this isn't about donors, but at some point it is about funding on there.
Yeah.
But I think that would be an interesting pilot program
Right?
to say, here's already young people, most likely, sometimes adults, taking initiative. And if we could do a pilot program and put someone there, the check-in is easy, it's seamless, it's
Yeah.
right when you get your lunch, on there, but do, some of that type of pilot work is, could be really an
Yeah.
interesting, thing to put out. And I think some of these people who are saying, I'm looking for solutions like this, say, yeah, let's start this with the next, pilot program. So,
Because they are trying to break the cycle of poverty
yeah,
time and again. Those are our students.
yeah, they've already signed up for classes. You're right.
Yeah.
They've already taken
Yeah.
meaningful steps in a program.
That's really good.
Do you work with Crossroads, or are you going to work with the Revive program, or are you downstream from them?
Downstream, but very connected. There's certainly, when I say the solution is people are underemployed, there's definitely a lot of folks that are, it's gonna be really tough to get them 200% of the federal poverty line. They're on disability, they need additional supports continually. But, short answer to your question, we're downstream from them. We wanna help have Crossroads, hey, let's get you out into transitional housing, from transitional housing to something more permanent. Revive, we ask people to be 6 months sober, and then continue your sobriety and continue your sobriety support journey. So we'll make sure that people still have their sponsor or whatever they're doing. That's been probably a big piece of that drop off. I've had a couple of folks relapse, and then we're still helping them, but we're just not helping them to bring forward. I don't know if that answers your question, but yeah, it's all tied together. Thank you all. We're late, but quick closing prayer, and then I appreciate you being here and appreciate you coming back next week to see and be with the islands. Dear Lord, thanks for bringing us together to learn and think, and challenge our own notions on the difficult topic of how to wrap our arms around all people in all situations. Thank you as we go forth this day, that we carry your love with us and have a blessed day. Thank you all very much. Thanks for being here.